Hi, today we're going to be doing a filler facelift or a liquid facelift. Most people want to do this procedure to avoid doing surgical procedures, and we've learned over the years that looking great and looking youthful isn't just about loose skin. It's actually about volume restoration. So we have several fillers available to us today that can accomplish this safely with natural substance that will be long-lasting. I prefer using two substances, one of which is called Radius. It's a calcium-based substance. It's long-lasting. It's great for cheek enhancements, lower face enhancements. I also use a lot of Juvederm, which is a natural sugar filler called hyaluronic acid. I use that under the eyes, in the lip area, sometimes along the jawline. There really is no best filler. It's really about choosing one that's going to be right for the patient. Every doctor may have his or her own preference. I work well with the ones that I have. If you come in a little closer and we take a look at the face, the goal here is not just about tightening skin, it's about slightly filling up a balloon. Now, the artistry in this procedure is not to overfill. You want to look natural. What you want to do is mimic the curves and the shape of the face the way it was a decade or two before. So over here we're losing fat volume. As we get older, we lose volume in the chin. Actually, we have bone loss and muscle loss in the lip area and around the chin. We tend to hollow out, collect fat in some areas, and lose fat in others around the eye. So by putting volume in all the right places, we can stretch out the plastic when we fill the balloon, so to speak. So we're going to do that. What's nice about this procedure is that it's quite immediate. It does improve over a few days, and it can be very long-lasting, where patients really only need touch-ups anywhere from 6 to 18 months. Okay, we're going to get started now. What I'm going to do is I'm going to start in the cheek area. I'm going to use Radius. What's nice about Radius is that we mix it with some Novocaine-like anesthesia, so it does get easier as we go along.
If I go like that means I have to scrunch my face
okay.
or something, you know what I mean?
I hear you. We're going to start right here. The patient basically sits with topical anesthesia for about 15-20 minutes. Sometimes I offer a mild sedative like a Valium or a Percocet, but it's usually not necessary. Bruising is very little. Obviously, it's partially has to do with the patient and then the operator who's injecting. There is an art to it. You're really not buying the filler, you're buying the artistry of how people mold the filler. Excellent. And you can see right away how things are filling up. Very good. Right where my finger is. It's always important to tell the patient where you're going. It tends to get easier as you get along. Good. If you want to zoom in, you can see how things are filling up right away. Okay. And what this will do is it actually creates a lifting effect. Now what we will see, in addition, is the stretching out of some fine wrinkles around the face. So when I go around the lower face here, you'll see things stretch out. And of course, it always helps to have a good patient.
Thank you.
Open the mouth just a little bit. Great. I'm going to build up the cheekbone a little bit. We always lose a little bone mass up here. Let's let some of the anesthesia go in and take a little break. Okay, now we're going to start working around the chin area. It's very important to fill in where there's been bone loss. And it actually creates an image of the jawline straightening out, because everybody collects some jowls around here. So if you see right away, we're straightening things out. Actually, sometimes we actually go and we build up along the jawline, because we lose bone mass there as well. can look at that. The jawline is getting straighter and straighter. There's very little inflammation. She's really just a little red from the needles. Okay. Put a little bit up here, and then we will go to the other cheek. Okay, we're going to do a little Juvederm around the eyes now. I'm going to start right here. Surprisingly enough, it doesn't hurt much around the eyes. It feels very similar to Botox for anyone who's had that before. It's about injecting small amounts and molding appropriately. I see how it's filling in already. I'm going to go right here where my finger is. Always looks quite painful, but usually not so bad. You can pull back a little bit to take a look. You can see how the eye is filled out dramatically already. I'm going to put a little bit to support the under eye, the central cheek. Everybody needs a little apple in their cheek. Great. This side's almost done. Close your eyes for me. Use a little bit of the finer Juvederm into the fine lines. Give her a little break once this side is over. Open your eyes for 1 second. Now you can close. Put a little bit more under the eye. We all tend to hollow out a little bit. Last one. Let's get a little fade back view so we can look at the two sides right now. Okay, she really has very little trauma, very little bruising or swelling. Actually, it's going to look a lot better in a few days, but you can see what we've done already. Now she has the normal contour of her face and a straightened out jawline. So let's take her and give her a little break before the other side. Okay, so we're done. I finished the other side. She's still alive, and she responded great. She's a little red. She has no makeup on at this point. She'll have probably no more swelling than she does have now. So both these substances aren't very reactive. Just to go over the areas we did, we filled in the cheeks here, enhanced the cheekbone, used radius around here to give her a little bit more apple. We worked around the eyes. She just has a few needle marks here with Juvederm, put some in the corners of the lateral lip. We worked on the jawline by filling in some bone loss here and muscle loss here to straighten everything out. And then we'll go over some before and afters in a couple of days when everything builds up. What's nice about these fillers is that in about a week's time, everything will even out. It'll enhance itself about 15 or 20% and will all settle in so the patient doesn't feel like they have something in there. As you can see here, some of the fine little lines that were there before, because there's some air back in the balloon, so to speak, again, these have spread out. And she's not in any post-operative pain. She could put on makeup, go out to dinner, go about her business, and she's quite fine. I used 3 syringes of Radius and 2 syringes of Juvederm on her. She did quite well. Obviously, the cost of this procedure is going to vary depending on the age and of the patient and what we're trying to do. It could range anywhere from $1,800 to $5,000, really depending on how much needs to be done. My general rule is you could always do more. So the goal is to have a natural result and a safe result. So I always start with a certain amount. As we get more comfortable with the patient and we take a look back in a week's time, we can always decide if we want to add to certain areas. But as you can see, this is a non-invasive facelift, doing things that you actually can't do with surgery. Okay, we're here about a week later with Geraldine. We've done a filler facelift, or liquid facelift. We've used Juvederm and Radius under the eyes, the cheeks, the jawline, the chin. She had a little bit of bruising, a little bit of swelling, but she is wearing a little makeup now, and we could see some of the remnants. If we can come in a little bit closer here, we'll take a look at what we did. So really, just small amounts of inflammation still left. This will all go down and resolve itself. At this point, she shouldn't feel like she has something in her face, but we should see dramatic difference here. This is a great procedure. It has very little downtime. She was in very little pain, correct? Was there any pain afterwards?
No, and the procedure wasn't painful at all.
Good.
That was great.
What's nice about this is that it's often combined with several things. Obviously, we're going to do some Botox on her today, but it's a great combination with Botox. I often use the filler facelift with thermage skin tightening, what I call the FLT procedure, which stands for fill, lift, and tighten. What we do is we're using the fillers to actually treat the volume loss and redistribution. But what the thermage radiofrequency device is doing is actually treating the lack of elasticity in the skin. So the thermage and the filler facelift can actually be done on the same day as the FLT procedure, as it's coined as a whole. We use Botox in the neck, around the lower face, as well as the upper face. And then for more superficial things, we use things like Fraxel and photofacials to really even out the skin pigmentation. And I think this is one very large step in a total rejuvenation for a patient without having to do certainly anything too risky or with anything of too much downtime or trauma. And that's it.